Hello, ladies. Welcome back. Now, if you have a vagina and you are in your early 40s or beyond, this video is for you. Something very important, historic happened yesterday. Experts from menopause, perimenopause space came together and finally challenged the black box warning, which is slapped on low-dose vaginal estrogen that was placed back in 2003. So it's a warning, and let's be real, has scared doctors, pharmacists, and women away from a safe, effective treatment for over 20 years. So I'm going to quickly go over all the doctors, their main points, and just summarize in the end. So let me break down what each expert says and why this moment matters so much. So the FDA Commissioner, Dr. Marty McCary, he opened by reminding us that women who had ovaries removed in 1950s saw a dramatic increase in heart disease, even fatal heart attacks by age of 28. Why? Because they lost estrogen. So he was saying that FDA is aware that how important of a role estrogen plays in a woman's body. So he emphasized that when started within 10 years of onset of menopause, hormone replacement therapy can reduce cardiovascular disease risk by 50%. And to this day, there is no clinical trial showing hormone therapy increases breast cancer mortality. So before we go into the summary points from each doctor, I just want to remind that they're going to be talking about hormone replacement therapy, which is systemic, which is something that you take orally, transdermal, or by cream or gel, but that kind of works on all over your system, versus local acting estrogen, and that's what the focus is. But a lot of doctors will also talk about systemic hormone replacement therapy. Before I forget, I just wanted to show you, this is what they're talking about. So this is the insert that comes with. So if you get prescribed the low estradiol vaginal cream, the insert that comes inside the box, it states that these are the side effects that can happen while using this product, and it lists
heart attack, stroke, blood clot, dementia, breast cancer, cancer of the lining of the uterus, cancer of the ovary, high blood pressure, high blood sugar, gallbladder disease, liver problems, enlargement of benign tumors of the uterus, fibroids, severe allergic reaction.
So let's start with Dr. Heather Hirsch. She's very well known in the menopause space. So she broke down clearly that low dose vaginal estrogen doesn't enter the bloodstream in significant amount to make any changes to the uterus lining or to act on any of the other receptors of the body. So it stays in your vagina. She emphasized that it doesn't affect the uterus, brain, or heart, and yet it's stamped with the harshest FDA warning, despite zero evidence linking to the stroke, cancer, dementia, and all the things that I just listed. And she called it what it is. She called it a harm. So the warning, combined with poor physician training, has hurt millions of women. And the second doctor was Dr. Barbara Levy. She reminded everyone that all hormones are not created equal. So we have to keep in mind that all the data that this box warning was based off of, they were synthetic hormones. And when we talk about hormones can come in different combination, different dosage, different route of administration. So not everything can be just lumped in one bucket and issued a blanket warning. So the WHI study used synthetic hormones. Like I said before, they used a horse urine-derived estrogen and medroxyprogesterone acetate. Now, so very different from today's bioidentical options. Okay, so the next doctor was Dr. Joan Pinkerton. She also spoke on behalf of Dr. Minkin, who was not able to join the panel. So she walked through the WHI data and she showed again how risks were overstated and misrepresented. The label was built on fear and not facts. And then came a doctor, James Simon, and he pointed out the inconsistencies. He says the other product that are used for the same conditions don't carry the black box warning. So he insisted that the FDA should be consistent in how they're labeling products and should be consistent with the scientific data that is available. He also said out loud, I think it was a very funny moment when he said, I'll say it what everybody's thinking, that vaginal estrogen stays in vagina. It doesn't go everywhere. So why the scary label? Then came Dr. Philip Serl. Now he focused on brain health. One of the fascinating points that came out of this discussion was all related to brain health. There are a couple of things that I was just blown away by. He presented data showing that estrogen improves brain fog, sleep, hot flashes, and lowers all-cause mortality. He shared data gathered from the insurance claim, revealing that women with hot flashes sees a doctor more often and spends more on care. He also stated that 50,000 women likely died between 2002 and 2012 because of estrogen avoidance. And get this, only 4% of women are on estrogen today. And before WHI study, it was 80%. Okay, so next doctor was Dr. Robera Brinton. She explained what happens in brain during menopause, and this blew my mind, and I'm so excited to share this. So she shared the data, and some of the data has been derived for Dr. Mosconi's research. She talked about glucose metabolism dropping in menopausal women, and since the brain cannot utilize glucose, and that has to do with mitochondria becoming inefficient in generating energy, the brain starts to use white matter to survive. So it starts to cannibalize itself to make ketones. That was just I was like, wow, or maybe hopefully they're going to do more follow-up studies on that, because my biggest question will be like, okay, so is it beneficial to be on a like a keto-like diet when you are in that age group? So you're already producing ketone and the brain doesn't have to eat itself to generate energy. I don't know. So hot flashes, she said that it's because your mitochondria is failing to make energy, and that's the root cause of hot flashes. She said estrogen helps restore brain energy production and many reduce risk for neurodegenerative diseases. Now, next was Dr. Wanda Wright. She is an orthopedic surgeon. Now she talked about bone health. She was crystal clear. Estrogen is the only treatment which is proven to reduce fracture risk. She warned that bone quality drops by 20% at menopause. So 70% of the women will have osteoporosis during menopause. There's this sharp decline in your bone quality. So even though the decline is very sharp, there's no warning signs. The first sign you will get that your bones are brittle, weak, is by getting a fracture, unfortunately. Okay, so next doctor was Dr. Kelly Casperson. She is the leader when it comes to talking about testosterone in a female population. So she said that 1 in 6 women will break a hip, and 1/3 of those women who have broken a hip will die within a year. So once women break their hip bone, their mortality goes off the roof. And even the data on returning back to your normal function is abysmal. She also again spotlighted, of course, testosterone therapy and the potential to reduce dementia and SSRI use. And she urged FDA to fast track approval of the testosterone for women, because as of right now, testosterone is not FDA approved for women. It's only FDA approved for men. So if physicians choose to prescribe it to a female patient, it is considered off-label use. And then either the option is to get it compounded in the right dosage, which most probably is not going to be covered by insurance, unfortunately, or get the FDA-approved formulation from the pharmacy and train or ask the patient to use 1/10 of the dose. So whatever a man is using in 1 day, she has to utilize that amount in 7 to 10 days. And then came Dr. Mary Jane Minkin. She cited Yale survey showing that only 30% of the physicians today are trained in menopause care. That's still is very low. And she stressed that 40 million cancer survivors deserve access to treatment like vaginal estrogen for sexual health. And then came Dr. Rachel Rubin. She's my personal hero. She's the one who led the charge in coming up with GSM guidelines that were just issued like two months ago, and I did a video on that. She made it very personal. She looked at the FDA and said, your label tried to kill my mom. Her mom was in ICU. She was bedridden. She was having recurring UTIs, and she asked physicians to prescribe estradiol vaginal cream, and the doctor was like, no, that is contraindicated. he cannot do that. So she said, I rolled up my sleeves, I showed him all the data, finally convinced the physician, and he did prescribe, but then pharmacy was not on board. Their system was flashing the warning saying that, that this cannot be given to this woman. So she then talked to the pharmacy. The pharmacy finally filled the prescription, and then the prescription, when it came back to the floor, the nurses did not know how to administer it. So she literally showed the nurses how to use the applicator. And I've seen it. It's not a rocket science. I mean, if you know how to use a tampon, that's basically how it works. So again, the problem was not that it was that simple. The problem was that the wrong labeling on the medication, and no training, because of course medical school are not teaching about those, since they're considered dangerous. Now, last person was Dr. Howard Hodis. Man, he was kind of funny, because you can sense the seething anger that was coming out of him against the WHI study. Not the study in particular, how the data was presented. And he clarified data showed that estrogen reduced breast cancer in certain population, and it lowered all-cause mortality when started early. So his point was that, a WHI should have stratified the data according to the ages, and then, talked about, the younger group is benefiting from this, and maybe the older group, which is, around 60, 65, are not seeing this benefit and even have a slightly higher risk. So it was completely age dependent. It depends on when you start your therapy. Okay, this was just not a meeting. I think this will help remove this dark cloud that's hanging over perimenopause, menopause, and maybe physicians from this point on will feel a little bit comfortable prescribing this, because they know now that FDA is aware. FDA is trying to address this and fix this. Now, this was different than FDA is never coming forward and saying, okay, it's been 22 years and we understand that how the data with WHI was presented was not really accurate. So this is the first time that I know of they're trying to go back and fix this. So maybe from this point on, if you go and you got dismissed before, you can tell them to go to FDA YouTube channel and watch that meeting, and maybe that will kind of help them sway in your favor. So if you have ever struggled with, again, painful intimacy, bladder issues, brain fog, and been told that, it's just aging, it's not. And the label change is on the way. And again, it's a turning point. So please, let's keep the pressure on. Let's keep talking about it. And I'll see you on the next one.